Every touch has the power to either deepen intimacy or break connection. Yet most men have never been taught how to use their hands in a way that truly respects and excites their partner. I'm Dr. Reed, a men's health specialist, and today I'm going to share with you a medically grounded, step-by-step guide that will transform the way you touch. This is not about tricks or gimmicks. It's about understanding the science of arousal, the importance of communication, and how to make your partner feel safe, seen, and deeply pleasured. If you've ever wondered how to move beyond guessing and finally know what really works, you'll want to stay with me until the very end of this video. Let us begin with the fundamentals: consent and preparation. No touch should take place without clear agreement. A simple, respectful question such as, "Would you like me to touch you here?" ensures that both partners feel safe. Preparation is equally important. Wash your hands with soap and warm water, keep nails trimmed and smooth, and remove rings. These measures reduce the risk of scratches, infection, or discomfort. A water-based, unscented lubricant is also recommended. Lubrication minimizes friction and enhances sensitivity. Step 1 is warming up the body. Female arousal is not instantaneous. It is a gradual process involving multiple regions of the body. Neuroscience research shows that anticipation and gradual stimulation increase blood flow to the clitoris, labia, and vaginal tissues, making later contact significantly more pleasurable. Begin with affectionate gestures, kissing the neck and shoulders, caressing the arms, stroking the lower back, hips, and thighs. As you move closer to the inner thighs, slow down intentionally. Over clothing, place your palm gently across the vulva, apply light pressure, and then release. This alternation creates waves of anticipation that awaken the nervous system. Step 2 is external contact. Start by gently tracing along the outer and inner labia with your fingertips. Avoid pressing firmly on the exposed clitoris in the beginning. Instead, focus on indirect stimulation through the clitoral hood. Research on female sexual anatomy shows that gradual indirect contact prevents overstimulation and helps build arousal steadily. Use soft, circular, or sweeping motions and closely observe her nonverbal cues, such as changes in breathing, subtle body shifts, or sounds, which are reliable indicators of pleasure. Step 3 is rhythm. Consistency matters more than randomness. Most women respond positively to steady, repeatable patterns rather than erratic movements. For example, you might trace gentle circles around the clitoral hood, move vertically from the pubic mound downward and back, or use side-to-side figure 8 patterns. 2 fingers can provide a broader sensation, while 1 fingertip allows for precision. Small adjustments in speed and pressure should always be guided by her responses. Short, specific questions such as, "Would you like it softer or firmer?" keep communication open without breaking the moment. Step 4 involves internal touch, but only with her permission. Natural lubrication signals arousal, but does not always mean readiness for penetration. Always check in first. If she agrees, apply lubricant to your fingers and insert one slowly, pausing at the entrance so the pelvic floor muscles can relax. Instead of rapid movements, use subtle motions, such as a gentle "come here" curve toward the front wall of the vagina. Studies show that controlled pressure and angle are more effective for pleasure than speed alone. If she tenses, withdraw slightly and return to external stimulation until she feels comfortable again. Step 5 is locating the anterior vaginal wall, often called the G-zone. It is positioned 1 to 2 inches inside, on the side facing the abdomen, and has a slightly spongy texture. As arousal increases, this area becomes more sensitive. Begin with light, steady strokes or taps, and increase pressure only if she indicates comfort or pleasure. Many women prefer consistency over intensity here. The free hand can be used simultaneously to hold, caress, or stimulate externally, creating a blended experience that activates multiple nerve pathways at once. Step 6 is scaling stimulation. If she desires more fullness, you can gently introduce two lubricated fingers together, maintaining contact with the front wall. Small controlled arcs or presses inside, combined with rhythmic external stimulation, are often more satisfying than large thrusting movements. As arousal deepens, subtle, deliberate motions become far more effective than exaggerated ones. Step 7 is approaching climax. As excitement rises, her body will signal clearly, quicker breathing, deeper vocal tones, trembling muscles, and forward-pressing hips. Once you establish the rhythm that her body responds to, maintain it. One of the most common reasons climaxes fade is because the pace or pressure changes at the critical moment. If she says, "just like that," or "don't stop," treat those as instructions to stay steady until she completes the experience. Step 8 involves variety. Many women enjoy techniques such as gently sliding the clitoral hood back and forth without direct pressure on the glands, long strokes that move from the thighs inward and outward to refresh sensitivity, or simply resting a warm palm over the vulva for grounding and comfort. Even small shifts, like elevating the hips with a pillow, can alter angles inside the vagina and enhance stimulation. Step 9 is about safety and hygiene. Always maintain short nails, clean hands, and adequate lubrication to avoid micro tears. If you move between anal and vaginal touch, wash or change gloves first to prevent bacterial transfer. Burning or sharp pain is a sign to stop immediately. Arousal should feel warm, stretching, or tingly, but never painful without her clear consent. Finally, step 10 is aftercare. Right after climax, sensitivity is heightened, so ease pressure gradually. Many women find comfort in gentle caresses of the thighs, abdomen, ribs, or even the hair. Offer water, stay close, and after some time ask a simple, open question such as, "What did you enjoy the most?" Her answer becomes your guide for future intimacy. A few important truths to remember. Not all women orgasm from internal stimulation, and that is completely normal. Some prefer external focus, while others enjoy a blend of both. The essential skill is observation, patience, and respect. When a woman feels safe, valued, and unrushed, her body responds with greater blood flow, relaxation of the pelvic floor, and heightened pleasure. Remember, your hands can be incredibly powerful tools when guided by science, sensitivity, and care. With patience and communication, you can transform a simple touch into an experience that strengthens connection and deepens intimacy. Thank you for watching, and I'll see you in the next video.